It's Autism Awareness Month, and I've been seeing patients with autism for 25 years. I've learned so much during the years and about so many different treatments, but a lot of the bedrock treatment principles remain the same. Let's talk about it. Hey everybody, it's Dr. David. So I hope that you're having a good day. Today is going to be kind of both a little basic as well as a review type of conversation. And certainly people who have followed me throughout my journey with autism will know a good amount, but you never know when you may pick up another thing or two. As I have shared before, the first patient I ever saw was when I was at Tampa General back in 1996 with a child with autism that we were asked to come see this patient because we may not see another one again. And of course, we quickly learned that that was about the farthest from the truth and how often and frequent people are being diagnosed with autism. And thankfully, now that we are doing so much more inclusion, and we are trying to do as much as we can to get people with autism to be active parts in our community out and about. In generations past, these were kids that were mostly being institutionalized or never left the home. And so we're certainly seeing a lot of them, but of course, we're also learning about the numbers continuing to go up. Now, I originally had a patient in my actual clinic after I left Tampa General, and when a mom came to me with a patient with autism, and she had heard about different types of nutritional treatments and diets, and asked if I would follow along and to do it safely and make sure that their kid, if they're going to be dairy free, casein free, which is the cow milk protein that we're concerned about, are they getting enough calcium and other nutrients there? That if they were going to be gluten free, to make sure that to help them out figure out what kind of foods they can eat because so much gluten and everything. And so that's kind of how my journey started, along with them asking to do some tests that I had never ordered before, but I could order them and they thought it would help and I wanted to help. And so that's kind of how it all got started. Okay. Now, first and foremost, one of the things that people all should know about is, of course, what is autism, right? And because there, and we now use, as you know, the autism spectrum. That's the term we use, of which I often will expand that out to the neurodevelopmental behavioral spectrum, because I find that not all patients will actually fit the true diagnosis criteria, but certainly have a lot of the symptoms or other comorbidities, other diagnoses, etc. But in general, we are talking about a core base issue when it comes to communication, behaviors, and socialization. Not everybody who has autism has difficulty talking. They may speak perfectly, but at the same time, they may not communicate in a conversational way as other people might. Other people, it may have to do some with not understanding body language, which is a part of communication as well. Eye contact and things like that. Again, that's all involved in that type of behavioral communication. But there usually some level, or of some type of communication. Sometimes they may have a praxia where they can't speak at all. But sometimes it could be more that just don't have like the pragmatic type of speech that may be necessary, or usually is necessary, to be optimal and interacting with our society. So, of course, there, when it comes to behaviors, we could be talking about symptoms such as flapping behaviors or spinning behaviors when they spin around in circles, or repetitive behaviors. And of course, sometimes it could be negative behaviors, irritable behaviors, hyperactive behaviors as well. And of course, depending on what type of behavioral challenge that an individual has, the different types of therapies would perhaps be different. So obviously, you wouldn't treat a person who is having violent behaviors the same way that you would have for someone who's just having some attention issues, or that were necessarily irritable. So part of a good history taking is trying to figure out, what those symptoms are, and of course, are looking from a root cause perspective, so we can help better figure it out. Now, from a social perspective, of course, many people with autism don't appropriately socialize, or at least appropriate according to society. And again, that could be lack of eye contact. That could be not really responding in an appropriate conversational way. Maybe they can speak, but they don't have back and forth speech. Maybe they don't know how to approach somebody. Sometimes it can be anxiety contributing, social anxiety, etc. But usually there's some level of socialization being able to play with peers, or interactively play. Some kids will play side by side, but not have really that interactive type of play. So those are the three core areas that we're talking about with autism. And I like to throw sensory in there too, although it's not actually part of the criteria for diagnosis, but recognizing that so many people with autism have sensory issues, some with sound sensitivity, where they may need to wear over the ear earphones that are sound canceling. Sometimes you may see a person with autism covering their ears in uncomfortable situations, even if there's not necessarily a very loud or obnoxious noise. There could be just certain sounds that will bother people. Other people will have more visual types of issues, where you may see them waving their fingers in front of their eyes or doing other types of things that are stimulatory to the eyes. And you may see other types of more tactile stimulation. Some are more like sensory seeking, where they want to put their hands into something. They want to get all messy. Even like fecal smearing may even be part of that type of thing. But then there are others who are tactile defensive. They don't like to be touched. They don't want to put their hands into things like shaving cream or finger paints, or getting messy, getting into the dirt. That could really throw them off. And of course, depending on what type of sensory issue a person has, that of course should dictate the individual types of treatments that we are doing for them. But there was a joke kind of back in medical school. They said, "Show me an asthmatic, and you've seen all asthmatics." Although there's mild asthma, moderate, and severe. And I've always felt that, show me a person with autism, and you've shown me one person with autism. Even for twins that I've seen, every two are different. Of course, no two humans are alike, but this is so true in a person with autism. And so the wide range of the spectrum, it's just so amazing what people, and a lot of times people are given with the label of autism, they're not given credit. They're not even taught about their potential because of the diagnosis. And of course, that's why it's so important for us to have advocacy and education for everybody in the world, so they know how to both interact with people with autism, how to best educate them, what kind of social organizations they can get involved with. I've talked before about the Penguin Project that I know it started here in Tampa, Florida, but it's other places as well as through the country. Musical theater, specifically geared for people with special needs, especially those with autism and Down syndrome. Just so many other things. Buddy baseballs that's available. It's just, we need to get our children or people or adults now with autism as involved as we possibly can. Okay. Now, I shared on this channel a couple of weeks ago about the continued increasing rise of autism. That's another thing people should know about. We haven't changed our diagnostic criteria. I said the same for, well over a decade and a half. Yet we continue to see an increase in the numbers of patients being diagnosed with autism. And that's obviously a real concern. It was at the beginning when they started with the new, more expanded diagnosis, and, taking away the term Asperger's and making it more into the autism of people who are higher functioning. And people were saying, oh, this is just due to relabeling, or this is due to better awareness. But that doesn't seem to be what's going on, because despite the fact that those awarenesses haven't changed of recent, the numbers continue to go up. And of course, that then leads us to another thing that we understand and now know about autism, people should know about, which is about toxic exposure. Okay. And that is something that unfortunately toxins continue to accumulate in not just the body, but our world. We know about these forever chemicals, these plastics that can be hormone disruptors, neurotransmitter disruptors. Terrible, right? We know about the effects of pesticides. We know that there are families who live closer to agricultural fields that are spread with, there are higher incidences of autism. We recently reported on patients who, if their mothers were exposed to higher amounts of lithium in the drinking water, had a higher amounts of autism. We know that heavy metals can be causing it. We know that, and have talked for a long time about how things like mercury could be an issue. And despite a lot of people having argued that autism numbers continue to go up despite vaccines no longer containing mercury, I can tell you that ever since the mercury was removed from the vaccines, and I always ask a family in a very open-ended manner, is there anything that you think have triggered the child's autism, the person's autism? I do know that since mercury was removed from the vaccines, I do hear that that open-ended question being responded with vaccines, like I did now. Again, could be different types of awareness. Maybe people are more not believing this anymore. I don't know. But I do notice that that is a coincidence. We do know that lead continues to be a problem. We know that it's a problem in certain people's drinking water, certain communities. Of course, they're supposed to be tested for, and we should be doing lead testing as part of 1-year-old checkups, because we know that you can catch it earlier, the better you can get rid of it, avoid the exposures themselves. And so we know that there is a lot of exposure. We know the importance of having clean diets, the types of exposure from that perspective, of avoiding high sugary foods, avoiding chemicals, avoiding all the dyes and all of the other things. That having a clean diet, treating your microbiome kindly, that's certainly an incredibly important part, not just for people with autism who do have such sensitivities, but also for the general population at large. We almost all of us can have a cleaner diet. I'm so thrilled and proud of some of my patients and their families who are able to keep such a strict, clean diet. I know that some people can't get organic all the time. That's why we talk about the clean 15, 30 dozen lists, so people can at least identify which are the produce that are more likely to have higher amounts of toxins than others, which ones are lower. So we know that those are kind of things that we can really be making a difference with. Now, we also know that even in terms of we've talked many times about the intestinal microbiome. How are the levels of the good bacteria? Are we eating fermented foods that make for a more optimal bacteria? We know that so many people with autism have intestinal issues. And we know that so many people with autism have taken a lot of antibiotics. Besides knocking out the good guys, did any bad guys grow in? Things like candida, clostridia, parasites, other bacteria? And of course, that's why we do the types of testing that we do in our clinic, to look for those things. We don't just treat thinking that it's there. We want to prove that it's there, and we can. So that's, of course, another big thing. Now, another thing people should also know about, besides the exposure issue, is the nutritional deficiency issue. So many patients that I see with autism have inadequate vitamin D levels, have inadequate zinc levels. As I've mentioned before, I look at both zinc plasma levels, which tells us what gets into the bloodstream, as well as zinc red blood cell levels, which tells us that's getting into the cells themselves. And we, of course, we like to make sure that there's not excess of copper relative to the zinc. But of course, looking for other deficiencies such as thyroid hormones, deficiencies in certain important mitochondrial markers like carnitine and like CoQ10. Deficiencies could be coming about because our bodies can't activate certain nutrients. Why we do our genetic testing to look at genes that are involved in the enzymes that are responsible for things like how we activate our nutrients, how we transport them, how we absorb them in the first place. Our max function test that we talked about that looks at all of those genetic markers, a test that only needs to be done once because it is your gene, and you don't have to check it over and over again because your genes do not change. Of course, a lot of people just do have other types of deficiencies, and taking a thorough medical history, or enough people getting enough calcium. A lot of people with autism are on casein-free, dairy-free diets. Are they getting enough calcium for the diet? Some people may not recognize that some of the plant-based milks alternatives are higher in calcium, and some are very little calcium. So reading labels, how important that is, because of course, when a person's dairy-free, we want to make sure that they're not calcium deficient. And there's all types of things that we go looking for, and that's why these tests that we do are so helpful. And the last thing we want people to know about is, and again, things that I've talked about before, are the importance of the role that cannabinoids can play in treatment. And I've talked before about how the endocannabinoid system is something that we all have. We all make cannabinoids, that we have cannabinoid receptors, that the plant-based cannabinoids are stronger than what our bodies make, that there are intoxicating forms when used at too high of a dose, like THC. We've talked about how using CBD can counteract that, but also CBD for just general purposes, CBG, which can be very helpful for things like depression, anxiety, moods, things like CBGA that can be used for anti-inflammatory purposes, CBN for sleep types of issues, etc. And that's why consulting with a medical professional who knows all the ins and outs and the types of dosing can be very helpful as well. So there is the kind of my lay of the land in under 15 minutes on autism as I see it. So I hope people continue to learn during autism. I hope people are acknowledged and being respected. If you know somebody who has autism, if you know a family who is being affected by autism, reach out to them. See how they're doing these days. Maybe somebody that you know a long time ago. You know, it's never too late to connect with somebody. So have a good day.